Mark Scar on KIOW. It's time for Hancock County Health System House Calls. February is American Heart Month. It's a great time to focus on achieving your optimal heart health. And today, our guest is Dr. Mark Lloyd, Hancock County Health System. Dr. Lloyd, good morning.
Good morning.
What is one change most of us could make daily to achieve better heart health?
Well, certainly there are several changes people could make in their diet to become more heart healthy. But one small thing people could try is to reduce the amount of sodium in their diet. Reducing your sodium or salt intake can help lower your risk of high blood pressure, heart disease, stroke, kidney disease, not to mention the bloating and puffiness that's linked to too much sodium. The American Heart Association has issued a challenge to change your salty ways in 21 days, toting that in just 21 days you can transform your taste buds, find and enjoy foods with more moderate levels of sodium, and reduce bloating.
It sounds easy, Mark, but it means more that the more salt you add from the shaker, correct?
Yeah, that's right, but it doesn't mean just to stop or lessen the use of table salt on food. We also need to focus on the nutritional labels of food and stay away from those with a high sodium content. Choose canned vegetables labeled no salt added, and frozen vegetables without salty sauces. When you're dining out, see if there are any low-sodium selections, and snack on fruits and vegetables instead of potato chips and other foods high in sodium.
What about increasing your level of activity? Is there a way to net big gains, I should say, with little effort in this area?
Yeah, we all know that benefits of regular physical activity, increased energy, better cardiovascular health, reducing the risk of heart disease and stroke and weight management, but about 80% of Americans don't make exercise a regular habit. Here are a few ways that you can sneak more activity into your life without much effort. You could take the stairs instead of the elevator. You could park and walk and find a farther parking spot from your destination. You could take your pet for a walk or dance or find a buddy to exercise with. If you do plan to begin a new exercise routine, it's always important to discuss this with your primary care provider.
Diet and activity are obvious ways to better health, but does stress play a part in heart health?
Certainly, stress plays a factor in your overall health. Your mind deserves better than to be loaded down with the never-ending job of worrying. While stress can be beneficial in some ways by leading to actual problem solving, a lot of our stress is unnecessary and even harmful. Research is clear. Stress brains do not operate the same way as non-stress brains. Here's a few tips for managing stress. If you do take time to learn your emotional cues, you can learn to regulate your stress so that if you were to pass into a high stress zone or emotional state, you could take a stress management moment, such as calling a friend, taking a short walk outdoors, keeping a funny book on hand that you can visit when you need a laugh, whatever works best for you. But taking the time to bring your stress level back closer to a lower level can certainly play benefit to your mind and body.
Something that's probably going to be a little harder for a lot of people will be quitting smoking and other tobacco products, but that's going to help as well.
Sure. Quitting tobacco could be the single most important step in achieving your optimal health. There are many, many benefits. Here are a few steps to help with quitting tobacco. You could write down why you want to quit. Do you want to quit so that you could be around longer for your loved ones, have better health, set a good example for your children, protect your family from breathing other people's smoke? Know that it will take commitment and effort to quit smoking. Nearly all smokers have some feelings of nicotine withdrawal when they try to quit. Nicotine is addictive. Knowing this will help you deal with withdrawal symptoms that can occur, such as bad moods and the urge to smoke. Your chances of quitting are better if you don't do it alone. There are many ways smokers can quit, including using nicotine replacement products such as gum and patches or FDA-approved non-nicotine cessation medications. Some people, though, don't experience any withdrawal symptoms, but for most, the withdrawal symptoms will only last a few days to a few weeks. Take quitting one day at a time, even 1 minute at a time, whatever it takes to succeed, and get help. Smokers can receive free resources and assistance to help them quit by calling the 1-800-QUIT-NOW quit line or by visiting the CDC's Tips from Former Smokers. Your healthcare provider is also a great source for help and support.
Dr. Lloyd, thanks for joining us on House Calls today to talk about heart health. We appreciate it.
Thank you for having me. These tips will hopefully help your heart and overall health.
Dr. Mark Lloyd is with Hancock County Health System. This has been HCHS House Calls. For Dr. Mark Lloyd, I'm Mark Scarr on KIOW.